Okay, moving right along, everybody. The next one in line is another very prestigious partner of Connetics USA. It is Baylor Scott and White. We have hundreds of nurses that are at Baylor Scott and White and hundreds more that are arriving there. And we're going to be welcoming the Baylor Scott and White team right now for our speed dating for healthcare workers. The Baylor Scott and White team are based in Texas, and we have joining us Marlene and Dr. Kate. Welcome, everybody. And the timer is starting. Marlene and Dr. Kate, go. 10 minutes.
Hello there. Dr. Williams.
Technical hitch today. Friday the 13th, everybody. We're having a few technical gremlins. Dr. Williams, are you able to, we can see you, but we can't hear you. Marlene, do you want to maybe get started?
Sure. Hello, everyone. My name is Marlene Porter, and I am a supervisor of the Transition Acculturation Program here at Baylor Scott and White in Temple, Texas. And I'm here today with Dr. Williams, Dr. Kate Williams, who is the director of our Nursing Professional Development Department. Dr. Williams, can we hear you now?
Thank you. Good morning, everyone. Thank you so much for this opportunity to be here and for the partnership with Connetics. And Marlene, would you like to share your slide? We are here to tell you about our amazing organization. I am Kate Williams, the Regional Director for Nursing Professional Development and Practice for Baylor Scott and White, Central Texas region. And with me is Marlene Porter. Marlene Porter is our Transition and Acculturation Program Manager for our International Educated Nurses.
Can the technical team share our slides for us?
Awesome. And so we're here to share with you about our Transition and Acculturation Program that is designed specifically to serve international educated nurses. And to share with you, I will share with you about myself. I've been with Baylor Scott and White for the last 10 years and came here directly as an international educated nurse, and has this tremendous opportunity to develop this program and operate this program in partnership with Marlene. Next slide, Marlene. So our program, our organization, just to tell you about our organization, our mission is that we're founded as a Christian ministry of healing, where we promote the well-being of individuals, families, and communities. And that is the framework that underpins our Transition and Acculturation Program. And the aim of our program is to warmly welcome our international educated nurses to Baylor Scott and White. We have an ambassador program that supports your personal and professional transition with our organization. We have personalized orientation as we have nurses that we welcome from over 35 countries. We focus on acculturation through a PenPal program, and we have mixers. Every quarter we have mixers, so we can start communicating with you, answering questions before you actually start here with us on our campus. In your professional transition, we have developed seminars. So we go over the business of healthcare, quality and safety, our policies, patient-centered care, and to help you understand our teamwork and how we collaborate, the interdisciplinary collaboration here. So we know our international nurses are coming to us with a ton of clinical experience and clinical expertise, but just to help you to form cohorts and identity with your peers and cohesiveness, we do bring you in for those professional development seminars to support you throughout that first year. We partner closely with Connetics, and we have guidance around community resources and to help you integrate and settle into your communities with your families, and with and to make sure you're getting housing and transportation and so on. We do provide a benefits package to you, and all the benefits that our staff receive day one, our international educated nurses also receive the same package. Next slide, as I tell you about our organization. So our Baylor Scott and White is the largest not-for-profit organization in the state of Texas. We are number 4 large academic teaching hospital, level 1 trauma in the nation. So we do have over 40 residency, medical residency programs. We have nurse residency program and nurse fellowship program. The Central Texas region of Baylor Scott and White comprises of Temple Medical Center. We have a cancer center, full service children's hospital, and we have over 300 primary care clinics. Our hospital here on the medical campus, we do have, you can see the numbers of outpatient and inpatient visits that we have, and we have different specialty areas that we will go on to. Marlene, would you like to go into some of those?
Sure. So our acute care, progressive care units, we have a total of 11 departments. And out of those 11 departments, 7 of them are acute care and 4 of them are progressive care units. And we have progressive care units that are specialized in our cardiovascular, neuro, trauma, transplant, and surgical. So typically this is where nurses come and build a foundation for nursing excellence in our acute care, progressive care units. Our emergency department is a 51-bed emergency department, and that with an addition of 3 fast track rooms. Very, very busy emergency department. We have over 72,000 visits per year, and they see a little between 200 and 250 patients per day. Great teamwork in this department. As you can see, they like to take pictures and pose. They have a lot of opportunities, such as the Unit Action Council committees. They do some interdisciplinary training with the physicians and the residents, physician residents, and lots of opportunities to be engaged in different committees. If you're passionate about stroke, join the stroke committee. If you're passionate about trauma, there's a trauma committee. There's a committee for anything that your heart desires. Our intensive care units, we have a total of 70 beds, and those 70 beds are split into specialty ICU. So we have our surgical trauma ICU, which is a 23-bed ICU. And like Kate mentioned, Dr. Williams mentioned earlier, we are the only level 1 trauma center between Austin and Dallas. So we see very interesting cases. Our cardiothoracic ICU, we have a 14-bed CT ICU. We are a heart transplant center, so having the opportunity to recover our cardiac patients that have just received fresh hearts. Medical ICU, 23-bed, and our neuroscience ICU. We are a comprehensive stroke center. We have a specialized ICU for just neuro patients, and that's 10 beds there. One of the things that we are very proud of, we have obtained beacon status through our American Association of Critical Care Nurses. All of our ICUs have either a silver or gold award. Our perioperative services, our main OR have 32 ORs, and they see over 17,000 annual operative procedures a year. Our PACU is a very large PACU as well, 54-bed capacity, and our day surgery is 48-bed capacity. And because we are the only level 1 trauma, comprehensive stroke, transplant, and so much more between Austin and Dallas, we see a lot. We do a lot at our hospital. And I'm gonna hand it back over to Dr. Williams to talk a little bit about McLean's.
Thank you, Marlene. McLean Children's Hospital is our full-service children's hospital across the street. Next slide, please. We have, as I said, a full service hospital. Our hospital also has an attached multi specialty clinics. Um, our kids are contained inpatient and outpatient. We have ICU, PICU, pediatric ICU that we do ECMO. We have a level 4, a neonatal ICU, a level 2 ED. We do have primary care clinics throughout the Central Texas region, and we have a full service OR. And the only service we don't offer in the OR is like transplants for heart, and that's something we're looking to do pretty soon. So we are the only pediatric facility in Baylor, Scott and White, and the only pediatric facility between Dallas and Austin. A very great team there. They offer full service, as I said before, and just a phenomenal hospital. Our hospitals are also magnet designated for nursing excellence. So that's it about our hospital. Any questions for us?
Wow, Dr. Kate and Marlene, that was amazing. I'm just sitting here thinking how exciting Connetics Career Day is for so many viewers around the world to be able to get this opportunity to meet your match, see which facility is going to, out of the 693 hospitals in the United States, we can see how different each one is and how nurses have got choice now to be able to see what's going to be the best match for them. And we are so honored and proud to be partners with Baylor Scott and White because they really are one of the most prestigious organizations in the United States. We have, I see one question in the chat. Do you have any vacancies in the NICU?
Marlene, do you know if we have current vacancies in the NICU?
In a neonatal intensive care unit, I do not believe we do. I do not think so. Right now, we are recruiting for our acute care and progressive care units, medical surgical ward experience, and so we are delighted and look forward to any applicants for med surg and progressive care.
Thank you, Marlene.
Thank you, Marlene, and thank you, Dr. Kate. If anyone was interested in Baylor Scott and White, please go to the Connetics USA website and apply right now. Our team are online right now waiting for you if you are interested to speak to you about this opportunity and see how we can make your American dream a reality by finding you the right match.